All right, we'll go ahead and get started again. Our last presentation for the evening will be the 26 budget forecast, and this is Rosh, Budget Director.
All right, good evening. What I'm going to try to do is give you a budget forecast of what FY26 looks like. As you all know, let me go through the, oops. So on the agenda, I'm going to talk about revenues, expenses, and then the next steps. We're going to talk about the continuation budget, a little about the expansion budget, and the next steps. Just a disclaimer, all figures presented are preliminary and tentative and are still being vetted. Figures will change until a recommended budget is submitted in May. As you all know, we've been developing the FY26 budget for the last several months. Our departments have provided their continuation and expansion budgets, and we're in the process of reviewing and vetting those requests. During the month of March, we have what we call our annual department budget conferences. These are meetings where county leadership, along with the budget office staff, will meet with each department to review the department's budget requests. It also gives the departments an opportunity to discuss and provide additional data and support, and also justifications for any budget requests they're making. The budget information I will be sharing with you today includes the department's continuation budget requests. The expansion budget requests have not been included in the budget data. These numbers, again, are still in the process of being reviewed and vetted. We have not received official budget requests from our educational partners. Those are due April 10th. In the budget today, I have included a 4.5% increase in the budget for the educational partners. That's in line with what we have in our 5-year plan. So first, on the revenue side, as you know, our largest amount of revenue comes from property taxes. During the last updates, both at the December 2nd work session and also at the 2x2 meetings we had with the Board of Commissioners, I was using a growth rate of 3%. Since then, I've got updated tax valuation numbers from our tax office, and that rate has been reduced down to 2.17%. With the updated data, we're estimating property tax revenues of $275 million, which is about a $5.8 million increase over the prior year's budget. I will continue to work with the tax office and make adjustments as needed over the next few months as we finalize our revenue projections for the recommended budget. The next largest piece of revenue we get is sales tax. I know it says sales tax and other taxes, but the sales is the major source of that category. We're currently projecting a 1% increase. We will continue to monitor the sales tax for the next few months and make changes as needed, maintaining our historically conservative approach to revenue forecasting. Also included in the category are bottle tax, gross receipts tax, cable franchise fees. Those are also all included in that number, but the majority of it is sales tax. The next category is intergovernmental. These are our DHS grants, other grants, and other revenues we get from other governmental units. And they're supposed to go up by about $797,000. The bulk of that is social services admin reimbursements and also foster care. We're also going to have a reduction in the grant revenues for transportation. Next category is permits and fees. Major collection points there are the Register of Deeds. They're expecting an increase of $577,000. Inspection fees, that's construction standards, we're expecting an increase of about $100,000. We do have a decrease in the gun permits of about $44,000. Next category is sales and services. A little while ago, we talked about ambulance fees. Those are supposed to go up by about $389,000. The biggest part of this increase that you're seeing there is from our deputy reimbursements. If you recall, last year, we had the public safety market study where the salaries will all increase. Last year, we were not able to get the municipalities to reimburse us because the deadline for our contracts was over by the time we had implemented that. So this year, that money is coming back in. So we're expecting about $1.3 million additionally coming in for that. As far as investments go, we've kept that flat at the $4.5 million. Miscellaneous revenues, that includes miscellaneous revenues and also fund balance appropriation. And the $227,000 you see there is a reflection of our Construction Standards Office going to be appropriating some of their fund balance. If you know about construction standards, any revenue they generate, they get to spend on their department only, and that's by law. And so they do have a substantial fund balance, and they're able to use fund balance. Typically, they're not, when the actuals come in, they're not really using up fund balance. They're typically adding a little bit to their fund balance.
And just quickly, the fund balance for that, when that law was initially established, we had discussions with the state about what that looked like. They will allow us to keep 2 years' worth of salaries and like our permitting, licensing, and things like that, operational costs that are associated with it. Because back during the recession, when we laid off a lot of building inspectors, we couldn't get them back fast enough. So this is one of the things that across the state that they allow us for us to retain some of that money and have it in case we need to hang on to some people in a situation where the revenues maybe aren't coming in.
Our sales tax was over 70 million in revenues.
Okay, so this is general fund only.
Okay,
A good part of our sales taxes goes to our CIF fund.
okay.
As required by law. There's 30% and 60% of, I think it's Article 42 and maybe 46 that go to the CIF fund.
Yeah, there's some of those dollars that are earmarked for schools.
Right, okay. Just wanted clarification on that. Thank you.
Yeah, of the 76, about 47 million is in the general fund. The balance of it goes to the other fund. So the total revenues we're expecting next year is 389 million, about 9.7 million more than the current year. Any other questions on revenues? All right. On the expense side, the major components of our continuation budget are salary adjustments, healthcare costs, retirement costs, and then other general costs, which make up our continuation budget. Again, the major categories, personnel services, those are all our salaries, about $5 million increase there. Employee benefits, about $6.6 million. Supplies, about $356,000. Then we got two categories where we're going to have a slight decrease, about $20,000 and $34,000. Other services and charges, $2.2 million. contribution to other funds or activities, $2.5 million, and capital outlay, $1.2 million. I'm going to get into a little bit more in detail in each of those categories in just a minute.
I was about to ask.
So on the salaries and benefits, as you can see there, we have, for salaries, $4.4 million. And we also have a category, I've separated overtime out there, $578,000 for overtime. Insurance costs, all of that is pretty much our health insurance increase. Social Security, Medicare, retirement, 401K, those are all related to the salary amount up above. And then other benefits, what's included in there is the retiree health benefits that are provided, also supplemental pension for law enforcement, and the Register of Deeds is also included in that $1.6 million number. So on the salaries and benefits, what's included in there is the COLA, 1% for all employees, cost of living adjustment. We also have merit of 0 to 4%. We typically budget about 3% for merit, and it's based on the service date. So if somebody started in May, for next year, we will only be budgeting 1 month's worth of merit, because they're not going to get it till the end of the year, so forth. So depending on when their service date is, that's when we start calculating the merit pay based on. What happens also is the previous year's merit pay becomes annualized, so that also hits us. Annualized cost of the recent market study adjustments. So that total is about $5.6 million, salaries and benefits for those categories.
Can we go back to the previous slide? I got a question on the overtime.
Okay.
So I know whenever we did the salary study and this board had increased salaries for, emergency services, that's where the overtime was, hitting us the hardest. And part of that was that with these increase, the increase in salaries, that it would cut down on overtime because we wouldn't have the turnover and all that. So it seems like it's increasing even more. So could I get some explanation on that?
So there are two major areas that make up that increase. About 370,000 of it is public safety, sheriff's office, and not sheriff's office itself has a decrease of about 95,000.
Okay.
The detention center has an increase of about $278,000. And then some of our municipalities have a increase. So Harrisburg, Midland, Mount Pleasant, they all have increases budgeted for next year.
So it's not going to cost the county taxpayer $758,000 if we're getting some reimbursement from
So on the
municipalities.
municipalities, the contracts do not call for them to pay us for overtime.
Why is that the case?
I have no idea why it's not in the contract, but they do not pay us for overtime, as far as I know.
Well, whoever negotiated that contract didn't do a good job. I would
As far as
imagine.
I know now, I'm
Yeah,
not sure if
that's
Sheriff Shaw
something we
knows
can-
anything different on that.
It's something we can look at the next time we renegotiate.
Yeah, that was a bad deal for us.
And the other thing it could be is the deputies working overtime may not be servicing the municipalities at that point. So I'm not sure if their schedules are flexible.
Well, and I understand that. if
That's
the-
correct. In other words, a Harrisburg deputy may work the fair, where
Okay,
we have typically $60,000 worth of overtime. So we can't charge the town of Harrisburg for the deputy working at the fair.
Right,
County
okay.
again. And that's where some of that, my understanding is that they are charged if the overtime is directly related to operational concerns within those municipalities, which is not a lot.
okay.
To be honest.
Well, that's
with you.
good to
But they
know.
are- It is a reimbursement.
Right, okay.
That's looked at quarterly, I believe.
Well, and I
think we
mean-
submit the reimbursement quarterly, and our finance person looks at those numbers and those
Okay.
types of things. But we do have some of that, because they're sheriff's office personnel, we have to use them sometimes and special events, those types of things that come along.
Okay, and that makes sense. Now, if they're getting overtime, with one of the municipalities, and then we're end up paying the overtime, I've got a problem with that,
And
so.
and they do. And I'll
Yeah,
use
okay.
the town of Harrisburg, for example, their 4th of July, those types of things. We've worked it out to where they direct pay any overtime to the officer.
Okay.
As almost like an off-duty, because we bring in regular personnel to augment the Harrisburg activity.
Okay.
Because there's not enough Harrisburg officers to handle the event.
Yeah.
And they pay that directly themselves.
Okay, thank you for that clarification. Thank you.
And the balance of the overtime increase is in the DHS area. There was a change made last year on how we pay DHS. They used to get a little comp time, and then some rules changed where they now get overtime. Now, last year, also with the transition they had in their administrative staff there, I'm not sure they ended up budgeting for overtime, so this is the first year they're starting to budget significant amount for overtime, which they do need, that budget there. And I don't know, Elise could probably address it.
Yep, I just wanted to also indicate that of that overtime for allowable services and social services, roughly 50% of it is reimbursable. So that's reflected in that intergovernmental line you saw in terms of the revenues. So some of that,
Does
even though
come
we kind of separated out for reporting purposes, some of that we're getting back.
Okay. I would like to see the breakdown, that number of how much we're getting back. Because when we see the overtime amount, now if we're getting reimbursement for the state and that number's less, excellent.
Yep.
But I would like to know the difference in that.
Sure.
Just out of curiosity.
Yep.
So, I'm sorry, so when you said that, when DHS, you said last year they were paid differently, or like it changed, where
think
did that
maybe-
change?
It was something worked out with HR, and they were being paid comp time previously, and there was excessive amounts of comp time happening.
So they were allowed to earn comp time, but the problem with it was they were earning so much of it and really not being able to utilize it. And so my understanding is, some of this decision happened before my tenure, but my understanding is Human Resources then sort of revamped that system such that they could just earn overtime. Now, we have undergone a very stringent effort within the past few months to limit overtime as much as possible. Some overtime is just unavoidable, right? So for instance, we have a person right now traveling to carry a child to a facility in another state. That's overtime. It's unavoidable. But they have to get approval now for overtime as well, whereas before, it was a little bit unregulated.
And we have seen that when looking at the numbers are coming down quite a bit after Elise and her group have intervened in it, and I think Holly and the rest of the people are working on it.
And Suzanne.
And one other piece of that is with the salary increases, the value of that hour goes up, so that has a little bit to do with dropping it up a little bit.
That's fine. I just remember whenever we, in previous discussions in years past, we have been talking about overtime and how it's a problem and it was hurting us, and then just to see it continuously increase,
And
it
we-
seems like maybe it's getting better, but maybe not.
I
We're
think
not
it
headed in the right
will.
direction.
Yeah, I think the sheriff has made a lot of progress with hiring and staffing up so that we're not paying overtime, significant amount of hours.
Last pay period, we had only one 12-hour shift that had to be covered with overtime.
So most of this is not public safety then?
But
Right.
again, you're kind of looking backwards to some degree as to what has transpired. It's gotten better every month. So, and great for my staff because they're not having to work all this overtime.
Right.
We reduced it this past time to one 12-hour shift of, we got to have somebody work overtime to cover the state mandated number of personnel on that pod. So we've made dramatic advancement. And so I now have more applicants than I have positions.
Well,
Great place to be.
Well, I appreciate that, and I know sometimes overtime is completely unavoidable, so it sounds like most of that number is not public safety.
Well, it's a mix, but we're going to continue to monitor that and continue to try to drive that number down through the being monitored, getting people in position so that we're paying regular salary, not overtime. But we will continue to work on that number. We would like to be conservative in budget for it, but we're going to continue to work on that.
Okay. Thank you.
Okay. All right, so we covered this slide. Okay, healthcare is another area. Okay. We're maintaining the same benefits as the prior year. The additional cost is going to be about $4 million. Last year, at least in the current year, we're going to be short about $2 million, so they're going to have to take that from the fund balance. As you know, our health insurance is a self-insured fund, so you got to be careful about what's there in the fund balance. They have enough to cover the $2 million, but we're going to need to up it by $4 million next year. $2 million for the shortfall, $2 million for a cost increase. Retirement rate, we have to make a contribution. This is controlled by the state. Every year, the rate seems to go up some. The contribution rates are going from 13.6% to 14.39% for non-law enforcement, and then for law enforcement, it's going from 15.1 to 16.04. About just under a $1.5 million increase. On our continuation general costs, the main categories that are making up that increase is circulation stock for our libraries. We have the online resources, along with the Afton Library and Mount Pleasant libraries that are going to be most of that cost.
And our online materials are getting a lot of use. We were running into people early in the morning not being able to access it because people had gotten online and there's a limited number of, uses that can go out in a day. And so we did attempt to up the circulation numbers so that people would have access.
Food for the detention center, it's going up by about 9%. That's inmate food contract for the detention center. Minor technology and equipment, I think that's primarily Microsoft fees going up, license fees.
Those are offset though, Josh. Those were offset by purchase services. So that's,
So we'll see a decrease on the other end, okay.
yeah.
So the circulation stock, you said a lot of that for the library, a lot of that is for the Afton?
Afton and also Mount Pleasant, they've grown in size there. And I think that's part of it. I'm not sure if Melanie
So that's-
You want to come up and explain the electronic better than I do?
Because what I'm getting at, that wasn't budgeted whenever we built the facility?
Well, this is not, we stock it, but then, obviously the first year in Afton, all of the books are new.
Right.
But like Mount Pleasant had additional books added to what was in their collection already. All of the other branches still have like circulation that's replaced. So every year we have to replace a certain number of books due to damage, age.
Well, and every time James Patterson publishes a new book, we got to buy multiple copies.
Okay.
So we'll be buying more new books for Afton people and Mount Pleasant people, along with everybody else.
Which I understand, but I guess that wasn't factored into the original cost.
The books that we're putting in the buildings to open were factored into the construction budget.
Okay.
So these will be everything that we purchase going forward.
And if I remember correctly, there's like 40 pallets of or 44 pallets
40
of books
pallets of
that
books.
were originally budgeted for. I mean, that's a lot of.
It's a lot of books.
There's a lot of
She told me
books.
about
Yeah.
putting them on the shelf the other day.
Yeah.
So those were originally budgeted for.
In the
for that.
construction.
Right, those
yeah.
are paid for and not part of this. This is just the annual purchase of books. Books are getting progressively more expensive too. That is a price that we've seen go up pretty substantially.
I was reading a news article today. The tariffs are, both the Canadian tariffs and the Chinese tariffs are going to affect the price of books because the United States does not have a lot of printing presses, so we print a lot of our books in Canada and China. So
Well,
that's.
hopefully they'll start printing them in the United States.
That would be great. There's also paper shortages in the US, and so we get a lot of paper from Canada. If I can just make a few comments about our ebook resources. We have two different platforms. We have Hoopla, which we pay for per use. So if you go to Hoopla and download an ebook or an e-audiobook, it costs us about $2 for that book. And then you all could read the same book and we would pay $2 each time that gets checked out. Our other platform is called Libby, and we pay $140 for James Patterson to be checked out 12 times, and then we have to buy it again. So the ebook publishing has libraries just over a barrel. It's outrageous, but it's what the patrons want. It's what, people who are commuting to Charlotte or anything, they want those audiobooks that they can download. So we get huge uses out of our ebook collections, but they are very, very expensive.
Okay, thank you. Thank you.
All right, the next category, insurance and bonds. If you remember, last year we deferred, again, that's property and liability insurance is a self-insured fund. And so last year we had sufficient fund balance, and management decision was made to defer that. And that money was transferred to the CIF fund to take care of deferred maintenance and those kinds of projects. So now that's coming back from that line, and you'll see it in the next slide where we're doing a minus there. We're adding it back here. Election expense, $224,000. So every other year or so, our elections office will either increase the budget or decrease the budget depending on the number of elections they're going to be handling. So next year, they anticipate doing about 3 elections. The previous year, they only did 1 election. So this is the added cost. Medical consultants, this has to do with the detention center and the inmate medical contract at the detention center. We did get some revised numbers after we had put our presentation together, so that number is going to drop by about $20,000. So on contributions to other funds or activities, this is a combination of things. Remember, I mentioned earlier we had 4.5% for our educational partners. It's part of this. The $5.1 million, that's what the 4.5% equals. Cabarrus Health Alliance provided their annual budget, and basically they're asking for a COLA and merit just like we have, and that's going to be about $609,000. Economic incentive grants. This is where we pay the businesses that have come to our area that have been given an incentive. It's going to go up by $530,000. This last year's budget was $1.9 million. It's going to become $2.4 million. This includes a portion, about $1.8 million for Eli Lilly, and a decrease for other ones that we previously were budgeting that we do not expect to pay next year, about $1.3 million. All put together, it's about a $530,000 increase. Contributions to the Community Investment Fund. Remember, I just mentioned the insurance and bonds amount. There was a plus there. This is the minus. Last year, we added this to the contributions to the CIF. This year, we're reducing it because it's now being budgeted as insurance and bonds. And last year, we had We Build Concord. It was a one-time allocation of $2 million, so that's going away for next year. A net increase of $2.5 million in the contributions line. Under capital outlay, matching grants, those reflect transportation grants that are going down. Equipment and furniture, I believe IM is not going to need to replace certain furnitures, and so that line is going down by $269,000. Motor vehicles, that line has also gone down. I think the sheriff's office is budgeting for a few less vehicles, and I think our normal vehicle replacement has also dropped some. So overall, when you look at revenues versus expenses, this is where we see our deficit still of $5.8 million. And later on in my presentation, I'll show you possible ideas to close the gap. Any questions so far? Okay. As I mentioned earlier, we're still these are pending requests. Cabarrus County Schools, Kannapolis City Schools, and Rowan Cabarrus Community College have not provided their official continuation or expansion requests. They're due April 10th, so we'll see what their numbers look like. Right now, as I mentioned earlier, we've budgeted 4.5% for them. All right, now looking at it from a 5-year outlook, as I mentioned earlier, we are building in some assumptions. Property tax growth at 2%, sales tax at 1%, permits and fees at 2%, sales and services as 2%. Just moving forward. On the expense side, personnel, we're doing 6% like we've done previously. Operating costs at 3%, education at 4.5%, Health Alliance at 3%. So in the 5-year plan, if we change our assumptions, we'll have different results, just so that you know that. I know this is kind of small, so I just want to show you what the 5-year outlook looks like, but I'm going to break it down into smaller chunks. This is small too, but I think you may be able to read it better on what we have in the handouts.
Is this one better? Is this one better?
So this covers the revenues. Like I mentioned, we built into the revenues for property taxes, 2%, sales tax, 1%, and so forth. Those are all built into the numbers for a 5-year look. And again, it's all based on a 57.6 cents tax rate. I'll move on to the next slide here. These are expenses on a 5-year look. Personnel at 6%, operating expenses, a growth of 3%. Community Investment Fund, we're pretty much keeping it flat as far as what we are transferring to them. Landfill, what that covers is our contribution to the landfill fund for recycling and waste reduction. And then going down further, you'll see under education, we have Cabarrus County Schools, Charter Schools, Kannapolis City Schools, and Rowan Cabarrus Community College. All of those are being increased 4.5% for each year. Other expenses to our outside agencies, we have the arena, we have Cabarrus Arts Council, Cabarrus Health Alliance, City of Concord MSD, City of Kannapolis, the debt. Now, that one's going to end in 2027. So as you can see, in 2027, the debt one drops. Economic development.
What is that one for, the city of Kannapolis debt?
The debt, I believe it has to do with the Cabarrus Health Alliance
Health
building,
Alliance
and I think there may be other things involved in that also.
Was there not wasn't a situation where the research campus is paying property tax to offset this at one time, and then it was a limited term? I remember this, whenever that building was built, that the state was gonna pay property tax
Do you-
on those buildings at the North Carolina Research Campus to offset the county's cost of the Health Alliance, but there's an expiration date on that. Is that correct?
There is, I pulled that after we talked about it a couple months ago, and now I've forgotten to. I will pull that again and have that available. But that one had an expiration date on it coming up soon. These,
Yeah, I think there's a gap where
Yeah.
we're not gonna get property tax on that, because it's unusual for the state, any government entity to pay property tax, but this was all done through the legislator.
Yeah.
And there's a gap where we're gonna end up being short.
Mr. Chairman, I think, if I recall, that was supposed to be the first 10 years.
I think it went on, I remember it being a gap of maybe like 2 or 3 from what I recall, but
I think David might
I don't
have
know.
some
Just-
information.
I was not involved in the initial plan of that, but it was very similar to incremental financing within that district, the downtown area. So as long as the increase in revenue met a certain threshold, then we had that set payment every year for that 10-year term, and this is the end of that term.
you're talking about downtown
In
Kannapolis?
Kannapolis, there was a district established, identified, so as long as the revenue within that district met that threshold of increase, then we were
So now how does that interfere with the other district that was set up? Because the next item,
That,
which was like-
that district is very similar, and there's some overlap in there. It's actually on top of, the second district there, the newer one, is a larger area, but the same concept applies. What that calculation is based off of is the increase in revenue over that initial year when we established that district, so.
so now what happens to that area that was an overlap? Because, you know, so what, because basically the county was reverting their property tax, the increase in property tax revenue to the city of Kannapolis for the downtown development. And then the other district was created supposedly to pay for the debt on the Health Alliance. You said there's some overlap, so what happens in that little area of overlap? Who does it go to? Does it,
The initial, what we call a TIF district, because it's a modified TIF arrangement, which is a tax increment financing agreement, was an agreement based upon the revenues that were established as an increase in that district, but it was not a direct payback of those revenues. It was just a determining factor within that agreement. As long as that threshold existed, we would make the split payment with Kannapolis in that term. And that's what's ending. So it was not identified as a repayment or an incentive of those revenues. It was just based upon that district as a threshold. We
did that
then, in
include-
the second agreement, the MSD that's been established is actually over and above that threshold. And so there really is no overlap in that revenue stream. The second MSD agreement has a baseline year of 2019. So anything over and above the revenues from that district in 2019, we do pay back a percentage as part of that financing agreement. So
So
that's the
the-
second line you see there.
the first arrangement, you said downtown, but from what I can recall, back in the day, it was the research campus. But
That's correct. So that's what when I
Okay.
say downtown, that's
Okay.
the general area. There's a specific district that was mapped out and created for both of those items. They each have similar properties within them. The second one is a larger area, however.
So now, when does that run out, the first agreement? When,
The first agreement is 27? So
Yeah,
it's
27.
almost at the end of its term. It was a 10-year agreement, I believe.
See the 1.3 million? I think that's when it's.
so then
ending.
how much more do we owe on the Health Alliance building then? Because from what I recall, I understand that maybe it wasn't written that way, but I remember the idea was creating that, and then the county would build the Health Alliance building in Kannapolis. That was the whole purpose of all of this. And so I was just wondering how many years we're kind of short of that, but.
That I don't have the answer to that. So that was before,
Yeah,
my position at this point is making sure we've maintained that threshold and therefore are making that payment.
Okay.
I don't have the
We'll pull that
details of that
information.
Yeah, we can
contract.
find that out. Okay.
Yeah.
Just curious. Thank you.
And then we have the EDC, Economic Development Incentive Grants. And on the 5-year plan, you see that amount will gradually grow. It's going from 2.4 to 11.7 million in 2029. Then we also have the JCPC, the bottle tax, mental health maintenance effort. That's the contract we have with partners, Rowan Cabarrus, YMCA. That one, I have in 2029, that shouldn't be there, the 250,000. I believe the contract ends in 2020, so I'll be adjusting that slide for that. 2028, yeah. It started in FY 2019, and it's a 10-year contract, so it'll end 2028, 2029. What I have there, 250,000 is incorrect. That's going to go away.
So the incentive grants, I mean, I know that these are already contracts that we're locked into that we can't do anything about, but the increase from 3.9 in 2027 to almost 10 million in 2028, is that the Eli Lilly? Or what? Why is there such a dramatic increase?
Eli Lilly is a substantial part of that, but that is actually it's more than just Eli Lilly. It's the timing of a number of those agreements that are just timing out to hit the payment being within that expense year. So
Okay.
what we've seen is a lot of the investment that has taken place from those are part of the growth we've realized in the prior years leading up to that, and those payments start to hit from an expense standpoint in these items.
Okay.
Mr. Chairman,
Yes.
I'd like to ask a question. I don't want to get shot, but I want to ask the question. Assuming, as I'm hoping, we don't add any more incentives ever, as long as we're here, when do the ones that we're locked into end?
Given our current scheduling from a calculation standpoint, timing can adjust on some of these, so this is our best estimate based upon the agreements we have in place. Look like tax year 2034 would be the last point of a payment to reimburse Eli Lilly.
I'll be gone by then for sure. Okay.
Yeah, and so the start date and the finish date vary a little bit depending on when the actual construction begins and the actual taxation begins.
That's correct.
So that's why we can't give you an exact year, but that's probably a fairly good estimation.
Thank you.
Question, sorry. Would it be possible to see line item for the incentives with the revenue for that, just to kind of make more sense of it?
I can pass these around. I've kind of prepared
Okay.
some of that. It's, what I've put together is based upon the value add, so to try to identify the difference between when we're adding growth based on those investments versus the estimated investment that's part of the agreement. So these are very much projections based upon what the companies themselves have presented to the commissioners and the agreements have been made on. A lot of times, these numbers don't result in actual value, so investment doesn't always equal value from an appraisal standpoint. So, all right, preface that by saying that. So,
And that incentive amount, correct me if I'm wrong, David, could be less depending on if they met their full incentives.
Has Eli Lilly they've not gotten their first incentive yet, correct?
they have not had
So
an
do we
incentive
have the
payment.
information on how much they've already paid in property tax versus how much that we were getting before they showed up?
So what I've put together kind of as an example, because I was assuming this would be some line of questions, is an example using Eli Lilly, just to show some idea of, if you can pass those around. So the second sheet I passed around is kind of a line item example of the full list that I provided. I know it's kind of hard to read, it's small numbers, and I can probably provide this digitally later, but ultimately, tax year 2023, the investment that Eli Lilly made is, as you see the first line, the real estate, about $104 million. That's an appraised value of the property as it was under construction, and that's the grantable portion of the asset. So that doesn't include the land, and this information does not include taxes on the land or anything else that wouldn't be part of the grant process. So these are not the total taxes paid by Eli Lilly, it's the total taxes paid on the new investment portion of that property. So 2023, they had about $100 million in real estate value, just over $1 million in personal property value. So total county tax only that they paid, that was at the prior tax rate, was about $780,000. There's been no incentive paid upon that. Tax year 2024, which we're currently in, you see the continued increase in real estate investment. They had some more personal property investment, total valuation at just under $600,000, which is about a $3.4 million county tax bill for just the improvements to the property, so not the land. And no incentive indicated upon that amount. If you'll see the green kind of circle, that value, once they pay that this year, the portion on the real estate, based upon the agreement they have, could become part of an incentive payment in the current budget that you're talking about. That's the blue highlight. So the taxes that were paid in this current year that we're in become part of an expense item the next budget. So that kind of, if you'll see the green circles in the lines where the investment happens, moves into an expense item later. So we realize growth in the previous year, and that becomes part of our expense outlay in this 5-year outlook. So ultimately, tax year 2026 is when they, based upon the projections, and these are all projections at this point, based upon the agreement that's in place, that's when we would start paying incentive the next year in tax year 2027 upon that first, what in the agreement is the $1 billion investment. Now, there's discussion about that increasing, that they've said they're going to have more investment. Our projections, both in this expense layout of the 5-year plan, are based only on the agreement that we have in place. Our growth numbers are also based on very conservative idea of what we know to be coming. So there's potentially more investment both in the growth revenue side and the expense side based upon what they actually do and what becomes appraised value. But these numbers are just for an example of what it could look like from a projection standpoint. So.
Do you have the numbers from 2022 and 2021 on how much that property was before they got it?
2022 and 2021 would be existing land value. I could pull that. I wasn't prepared for that. Thank you.
So looking at the 5-year plan, we've seen the total expenses for each of the years is shown there, and then previously I'd shown you the revenue side of it. the net result, when you take revenue versus expenses, in 2026, we're looking at a $5.8 million deficit. 2027, about an $18.4 million deficit. 2028, $34 million deficit. 2029, $48 million deficit. And 2030, a $61 million deficit. And this is all based on a 57.6 cents tax rate as far as our property tax revenues are going.
And again, these numbers are a good bit larger than what you saw last year because we did dial back the growth
Yes.
by almost 1%, which it didn't seem like that much to me. I had conversations with everybody in realizing that 1% of billions is a lot of money still. So these are substantial increases in debt projected based on, a lot of it has to do with the reduction in the growth estimates. So again, these are all, projections. We don't have a crystal ball, but that's kind of why that has grown substantially.
And so whenever you say that, reduction in growth, and that's based upon actual numbers that are coming into the county as far as pulling permits, and is that correct? Because, all we hear about is that our area is growing, and by 2030, we're going to have double the population. So we hear, we're hearing, from the school system that growth is coming here, that it's already here and it's just going to explode. But then now we hear maybe numbers are coming down. So how do we
I think there's-
quantify?
So what we're doing from a conservative approach to revenue projection and changing that from what we've used in the past is a 3% increase year over year. We're changing that now based on a number of factors. One is that this early in the process, we're being conservative because we don't know yet what property is going to be listed in this from a business personal property standpoint. So speaking of Eli Lilly specifically, we don't know what their investment numbers are going to look like that they've had in the past year yet. We typically don't get that till mid-April. So at this point, we're being conservative in that outlook, and that extends out the further into 5 years you go, the less accurate my projections are going to be. I'm not a futurist. I'm just basing on what my current analysis is. So looking at that revenue projection, we're being very conservative on that end, reducing what we think is going to be out there. You mentioned the growth that people talk about. So what we're looking at is revenue growth from a tax base perspective. So growth in housing certainly doesn't bring the same kind of investment numbers from revenue tax base as large industrial commercial investment. So there's a difference in how growth affects tax base depending on what the property type is.
So we're expecting a slowdown in commercial growth?
We're seeing a slowdown in commercial investment based upon general factor. Inflationary economies make companies spend less on new equipment. So personal property, business personal property is a depreciating asset. So each year we see depreciation in assets. That typically has been compensated with more investment than we see depreciation, but that is starting to equal out. So we're seeing less growth than we have in the past, just based upon typical economies. We're projecting less new investment, just because we don't have any in the kind of the pipeline beyond what I showed you in those incentive numbers, just from a general standpoint. So that's a conservative approach on the top end. And like I said, the incentive and agreements that are in place, it's conservative in what we're projecting from an expense because that's basically the worst case scenario in those agreements. Those typically will end up being less expense over time, but we want to be as conservative as possible when we're projecting those. So.
And, if we do see in April, the trend being different, we can adjust. This was just the most conservative approach.
Well, I appreciate doing the conservative budgeting. I mean, the last thing we'd want to do is get into it and, have a situation. We don't want to get in a situation. So,
Right.
So I appreciate that. I wanted to hear how, we hear growth is, I mean, we've all seen the growth, but
and it is a shocking number at this point, you know, it shocked me. So, you know, I did have those conversations ahead of time to, you know, make sure I understood it and be prepared to explain some of that. And, you know, like I said, we'll, as we get closer to April and we have better understanding of where those numbers are coming in, we'll get back with you if there's adjustments, hopefully that are more positive.
Let me ask you this, the We Build, the $2 million that was given in that last year budget, do those homes pay property tax? Do we receive property tax revenue from the homes they purchase?
We will.
We
Yes.
will,
Yes.
Those are,
Yeah,
even
they're-
though it's a nonprofit
Yeah,
organization.
so the way that their organization would work is either it's sold to a private individual and they own the land and the house and they're paying taxes just like anybody else. There's no, unless they have one of the state incentive things, like a veteran or something like that, they're not getting any discounts on taxes. The other option that they have discussed doing, and I don't know that they've actually produced any that like this yet, is an arrangement where We Build would own the property and the family would own the house on the property, so similar to what you would do with like a condo. So they would be paying taxes in that scenario on the structure, but not the property. And then they have some rental units as well, and they would be paying taxes on those regularly.
So which arrangement are they using then?
It could be any one of those. So we haven't actually started putting money in yet on that. So that would be they could do any arrangement that they want with it, as long as it has an affordability clause in it, that the house has to stay affordable, or the property, really, you know, whatever that arrangement is in that case.
property that is owned by We Build, if it's used for affordable housing, can be exempt from property tax. But as soon as they transfer that to another individual owner, that becomes a taxable property. So if they maintain the property and were to have some arrangement where it's still in the name of We Build and it's used for affordable housing, it can be exempt, but that's not their, as far as I know, that's not their intent for all their properties, to maintain ownership. They want to transfer those into individual owners, and those would be taxable at that
So I
point.
was under the impression that We Build would basically own it. Now, someone, you know, purchases the home and builds the equity, but then whenever they sell it, it goes back to We Build, they get the equity out of it, and then the process starts over with another client.
It could be if they have, there's, like I said, there's different arrangements. The ones that I'm aware of that they've done early on were a sale of the entire property, the land and the house. But there is an idea that they would own the land and do what you were talking about. It's, you know, the family owns the structure itself. And so there is an ability to build some wealth in the family. So in the future, if they wanted to will that to their family, they could. But if they went to sell it, there's a split on the profits, so the family gets some and We Build would get some, but We Build will continue to own that land.
Okay, that's a very complicated process.
It is complicated, and that's why most of the things that have happened so far are just traditional sales.
Okay.
Based upon what that arrangement looked like, would determine how much, if any, of that property would be exempt from taxes.
So that's the 5-year plan. Next, I want to share with you what we got in for expansion requests. They're in 3 categories: expansion other, new positions, and reclassification of positions. And share with you the details on the expansion other. Arena and Event Center is requesting a events coordinator and manager. Incorporated, and they're also asking to purchase a concession point of sale system. So those are the costs, the $86,000 and $35,000. Cooperative Extension has requested a community food extension agent. Now, both these entities, the positions you see there are not county positions, so they're basically a contract payment to them.
And we have not, at this point, included any expansion request in the
Yeah.
budget. These are just informational for you to know. We did want to document the needs, but at this point, none of these are included in the budget.
How does that fit in with cooperative extension since they lost two to retirement this year? Would that not just be able to go right in there? Or,
Both the positions that retired this year were in the continuation budget. So this is an additional that would actually be covered under that deficit. So we have a lapsed salary because of two news are much lower in their salary versus our 250-year that retired. So in that position that's in there is a 50% copay with NC-A&T State University.
Is the 38,000, is that our 50%?
That is
Yeah.
our 50%.
And so I know you said with the lap salary, it would cover it this time, but going forward, whenever you
Right.
fill the other two positions, it wouldn't.
Correct.
Yeah.
Yeah. So, yeah.
And so what
General.
is community food extension agent? Can you explain what that would be?
So that fills the gap between the needs of the farmers and then the needs of people with food nutrition. So it's the farm to fork part that's in between. So working with our, anything that's in the community food system, so all of our markets that are doing any kind of wholesale foods, any of our CSAs, any of that kind of stuff, working with the farmers markets, all of our, anybody who sells food wholesale in that smaller market has to have certifications. We have to go out, they have to have their scale certified and all of those kind of things that are not really within a specific part, because right now we have a horticulture agent and we have a food nutrition agent, but we don't have somebody that kind of fits that middle part there. So that connecting local agriculture to people, and that's probably one of the biggest questions that we get every day is,
Or was
you know,
Pam the food and nutrition?
yes, yeah.
Could this be incorporated in that position as you go forward to hire somebody new? Could that be incorporated within what she was already doing?
If we do not, I mean, that's how we've been functioning so far, but it is overwhelming to try and fit that position in with the needs of the community within the local foods.
Thank you.
The other expansion, new positions, emergency management has requested an assistant EM coordinator. Fire service is requesting a deputy fire marshal. Planning and development is requesting a planning technician and a zoning compliance officer. Human services has a lead accountant. And active living and parks is requesting a active living center superintendent and a park superintendent. Total of 7 positions. Total cost, including equipment and vehicle, $870,000 for all of those positions. The other requests are reclassification. I'm sorry, this is kind of small too. But there are about 29 positions that are needing to be reclassified. So moving from one grade to another, or from one category to another. The total for that is an expense of $268,000. Of that, but we would generate about $8,000 in revenue that has to do with the DHS positions. So a net cost to the county of $260,000 for the reclasses that are stated there. And if you need any additional details on any of those reclasses, we can provide that to you. Any questions on the expansion requests? Okay.
So we're only asking for seven extra new positions
Yes,
out of all of our departments.
that's right.
What's,
Those are the most pressing needs that were presented.
we have 34, 36 departments. farms? Go ahead.
Quite a few.
33.
Because it looks like you guys have whittled that down pretty
How many,
extensively.
how many positions did we add last year? Do you remember off the top? When about 30 to 40?
Yeah, there was no expansion in that drove a good portion of that.
But these 7 that we've got listed here, that's what you guys have deemed. I mean, we need those, like that's.
Well, again, we did not include any of the expansion at this point, because we wanted to try to cover the gap that we already had before we considered anything. And so we just wanted, for documentation purposes, you know, we could have not had anybody enter anything, but we didn't want you to not see what the needs might be in case there were some of those that you felt were important and you wanted to move forward even though we still had a gap to cover. So that was kind of where we were at, is let's show them what the needs are. And, you know, if we don't tell you, you don't know. So it's out there for you to see and consider, but we do not have them included at this time.
Not to put anybody on the spot, but Londa, can you come up here and tell us what the ALC superintendent and park superintendent is for, since you're here? And I know you do a lot with a little, so I was curious if you could fill us in.
Yes, several years ago, might have been the 2 market studies ago, when we found a lot of our folks it was dead end, and we were trying to figure out how we can make a good succession plan, and that was one of the things that came out of the surveys. We started growing then, more and more people coming, and with the 2 new active living centers and the purchase of the land in Mount Pleasant, a lot of territory to cover and not a lot of staff to do that. So that's why this is maybe the 3rd year that we've put that in, at least 3, if not, I think it's the 3rd year that we've put it in, trying to help the department keep we've got some really great staff, and we don't want them to leave. We want them to be able to stay here and move up.
And I know we had the community needs assessment meeting the other day, and City of Concord park manager gave a presentation, and with the year of the trail, I know parks and outside recreation continue to be one of the #1 things that people that not only live in the community but are looking to move here, that's what they want. They want to be able to be outside. So I appreciate you always doing a whole lot with a little, and I also know you've asked for some growth for several years. But I mean, that's continued with the community needs assessment. It's continuing to show that is a need that the community wants, and so it's just going to grow. That need's going to continue to grow.
As Kasha talked about the survey and our master plan, the same company did that, and the survey along with Barry Dunn doing the master plan, that was one of the things that kept coming to the top from the staff as well as from outside as to what's going on and how we need to help increase our presence in the facilities. Thank you.
And, well, that's okay. It's not a question for you.
Oh, I might
More for-
answer it though. Go ahead.
Well, you might. Okay. Well, that's fine. You might be able to. So I know Kelly, was not as involved in this process last year, but if she's asked for this for 3 years, last year we gave 30 to 40 new positions. Why was those prioritized over this one? So I don't know. I mean, I'm just curious.
So last year, some of the Medicaid ones drove a lot of it, and those did get reimbursement. So, sometimes jobs that get reimbursement get higher priority because they have some offset to that cost. One of the unfortunate parts about parks is they don't really have offset for operational cost. A lot of times we can get money to buy a park, money to do investments in parks, but you don't get money to operate them. Other departments have that problem too. Libraries have that problem. A building inspector, we offset that pretty much 100% with fees. So, it really just depends on the situation, and you look at how much can you afford that year? What is the goal for that year set was, and we go for, and work backwards off what you got reimbursement for, what's the highest priority, is it public safety? So those are kind of the factors we take into account as we do that.
Well, I understand that. And then unfortunately, the Medicaid expansion, we're not getting full 100% reimbursement like we were told we were going to get by the state when they voted on Medicaid expansion. But that was part of the state, promised that the counties were going to get 100% reimbursement on those positions, and it did not happen. So I pointed it out last year, I'm going to point it out again.
And I know that as many people as use those parks, we all get the emails and the phone calls with how busy they are. And Londa, you guys are doing a great job trying to make that happen, but it's obvious they're getting a massive amount of use. So
Agreed.
hopefully we can look at it this
Quality
year.
of life and well health is hard to put a dollar figure on. That doesn't come back and show in the revenues, but all of our citizens show that.
Mr. Chairman, since you brought that up about the Medicaid expansion, I want to give you a little insight on that as having been there in Raleigh when that was going on. We kept saying no to it in the Republican caucus and in the House. Senate wanted to push it. They wanted to do it, want to do it. And the Speaker had to keep telling them House isn't going to go for it, because so many of us looked at that thing, were in the committees where we heard from people from other states about it, and saw this was no way to go. And so we wouldn't do it. Well, the next year after I left, they approved it. But what we heard time after time after time from people from other states who had to deal with this was the federal government promised you they're going to give you 90% of the cost. And they do it for about 3 years, and they pull the rug out from under you. And so I told them, when the Senate put their bill forward, they put in there a provision that if the federal government quit giving that 90%, we would end the program in North Carolina. And I told them right straight out, the reason you're doing that is because they will, at some point, pull that rug out from under you. It's exactly why they put that in there about dropping it if they didn't keep getting the 90% of the federal government. So it was a bad idea. I mean, they were allowing people who make a lot more money than I will ever make get on Medicaid. That's ludicrous. So that's why you're seeing what you're seeing about that.
If we have time, can we have also, and I don't want to put them on the spot, but if they're asking for spots, Jason for the EM coordinator and deputy fire marshal and whoever for the planning technician. I'd like to hear, this is our chance to hear the need for it. I know they've put it in. I don't want to put you guys on the spot, but we get a chance to hear.
They entered it, so they know their demand.
We can go through each one.
Yeah, that's fine. Jason, while you're coming up, just on the reclassifications, we have a couple of those that are repurposed jobs, and so we're looking at those because they may not bring as much expense because they were somewhere in the budget already and may be being repurposed from position that did not bring revenues to one that brings revenues. So
We don't have to go through those.
yeah,
That's
well,
okay.
I just
Yeah.
wanted to add that to the conversation, so you're aware of that, Jason.
Sure. Good evening. Thank you for the opportunity to come before you. So one of the things with both the positions is both of these were in last year's budget as well. So we've continued those forward based on the needs. I'll start with the emergency management position. So a few things there. One of the biggest things is kind of the emergency manager for the county as I look at the event that just occurred within North Carolina last year, which was Hurricane Helene. And I look at the impacts to our western counties and the citizens in those areas, and just thinking about the overall dynamic of something like that occurring here, our staffing level is pretty low overall. I have 2 FTEs. Myself is the third position, but I'm also split between managing the fire services division as well. So it's almost kind of what I consider kind of like a half an FTE to a certain degree there. And for a county of our size, with the potential impacts of a storm that was literally just, a couple counties away from us, I look at that as a determining factor in the need for that additional staffing, so that if we do have something that occurs, we have the capacity in order to do everything that's going to be involved in the response and the recovery piece of that. Some of the things that we're doing right now, which a lot of the departments in here are currently working through, is we are trying to expand the capacity of doing tabletop and full-scale functional exercises. We have not really done those much in the past. One reason has been staffing. The second piece of that is that by doing that, it allows our county staff and all of our partnering agencies to be able to go through that process to understand what it is that we're going to be asking them for from their experience or from what they can do within their agency to further assist in that emergency or that disaster. We also have some additional requirements that have been set forth for our LEPC, our Local Emergency Planning Committee, which is the Tier 2 based stuff. So the quantity amounts of products and chemicals that are stored at some of our companies and businesses in this county, they have certain sets of requirements that are set forth, such as tabletop exercises, full-scale exercises, other types of reporting things that are needing. We're getting a lot higher demand for that as well. So with that comes the need to facilitate those. And if you've ever tried to put an exercise or something like that together, it's not as simple as just sitting down a couple weeks and being able to put something to paper and then to a presentation. It literally takes months to be able to do that, because you have a planning committee, you're working with these businesses, or you're working with other partnering agencies to determine what their capacity is or what they need to maybe even exercise from their standpoint to help them with some type of requirement, whether that be a grant or whether that be some type of other measure that needs to be met. So it's kind of a way that it brings everybody together to meet multiple different things, but also allows us to be essentially more mission ready in the event that we would have something that would affect Cabarrus County. The final piece of that is also building in a career development pathway for emergency management. The two other positions are emergency planners within our Department of Emergency Management. The only growth potential that any one of those two positions has is the department head. And that is a very significant hurdle, because the department head position also needs to have a strong fire background. And most of the time you have an emergency management position that has no fire background at all. So it makes it very challenging for them to be able to grow within the organization. Obviously, when we hire somebody, the goal is to keep them here until they retire. But if they have no forward growth potential, then at some point, they're going to have to make a tough decision in that. So we want to try to give them the capacity to grow within the department as well, keep them here, keep that knowledge here and everything, so that we can continue to use them in that capacity. Then on the fire side, the deputy fire marshal position, we have continued to see, just in the last couple of years, continued increase in new construction development, and that's not necessarily just commercial business properties, but as you mentioned here just a little bit ago in regards to residential growth, we have certain types of inspections and things that are involved in the early stages of that process. Now, while the fire code enforcement doesn't extend to the residential once it's built, there are a number of different inspections that have to be conducted leading up to the actual development of that and everything. So we have seen a substantial increase in those volume of inspection requests, and overall within that department, that is kind of leading us to the need for an additional position within there. They are also and continuing to work with the county fire departments as well. We have a new 911 CAD system that is coming online. There's substantial work that's being involved in the back end of building that particular system out, and then the maintaining of that as we move forward. And as we continue to look at the dynamics of the volunteer fire service as well, and where that's going to be in years to come, our fire services division is going to continue to work with our county fire departments and looking at, different avenues for staffing or different ways in which we can enhance or find ways to do that, because it's becoming quite challenging. The final piece of that would be is just as very similar to what emergency management has, is there's limited growth opportunity within the fire marshal's office as well. And again, that career development pathway, we hire them, we train them, we want them to stay, and we need to give them an avenue in order to grow within their position as well. Be happy to answer any questions. Thank you very much.
Susie's coming up to answer the questions about the planning and zoning ones.
Good evening. So we did want to kind of get two positions on the radar. We have been talking about these for several years, and it is time now that we kind of need to start working towards this. In 2010, a lot of people don't know, planning and zoning had positions that were riffed due to the economy. We used to have 4 full-time planning staff. We had a full-time intern that we paid as well. And then on the zoning side of the house, we had 3 staff. One that primarily was assigned to permitting, and then 2 zoning enforcement officers. Since 2010, none of those positions have been brought back to our department. So we are still working on 50%, trying to keep up with everything that we have. So that is where the planning technician would come in. This would be an entry-level position. We currently, the way that we are structured in our department, most of you have stopped by or you're familiar with it. We have one person that is at the counter that handles zoning permitting, and that is that person's primary responsibility so that they know the ins and outs of the ordinance as well as Excella. When that person is out, I have to pull someone from planning to cover the counter. If that is not something that can happen, then a lot of times I actually have to pull one of the zoning enforcement officers in from in the field to come into the office to cover. So we don't have redundancy with positions like other departments do. You know, some departments, maybe they have 4 people that do the same thing. As planning and zoning, we all kind of have to work together, even though it's 2 different divisions and 2 different budgets, to try to make sure that the work is covered. So, you know, that is where these 2 positions are coming from. With the zoning compliance officer, it's the same thing. I currently have 2 compliance officers for the entire county. We are experiencing a lot of growth. Along with that growth and people working from home, we are also experiencing an increase in complaints. So again, if you know, say if somebody's out for surgery or, you know, somebody decides to take a different job, we have one person to cover the entire county. So there is no redundancy, and there really isn't even the ability to cover because the way that the areas are, one is north of 49 and one is south of 49. So if you think about driving from the Walmart in Kannapolis down to Georgeville Fire Station, I mean, that's a lot, you know, so it's not efficient for somebody to go from, you know, Gold Hill down to Midland and actually be able to get a lot accomplished. So that is the reasoning behind the 2 of these. And, you know, we would appreciate the consideration, but we also understand that the budget is tight. So we really just wanted to get these positions out there because, again, most people don't know that we were one of the departments that were impacted when the positions were riffed in 2010.
And I understand the budget being tight, but for 15 years, you've handled your department on half staff, is what you're saying, for 15 years now. That's, thank you.
And I will ask Suzanne Moose, who is our Health and Human Services Business Director, to talk about the need for a lead accountant in our area.
evening, Commissioners. The lead accountant position within Human Services, it would be located within our DSS department. The DSS department is really a very critical component to the success of our fiscal sustainability. One of the areas is our reimbursement, which is critical. We bring in at least $20 million of federal funds in reimbursement here to the county. We cannot afford to not maximize that. The infrastructure of the DSS side has not grown in 10 years or more. When I was here previously, when I was employed here, it still has the same amount of staff within that department. Although the growth of foster care, which is very critical to the maximum reimbursement to the county, has gone, when I left, from 62 to about 200 foster care cases. And so that's just one example. But one of the things is this position is going to be key. When I say maximizing the federal and state dollars, is because all of our staff are required under North Carolina to key in day sheet coding, and that day sheet coding is what goes to the state, so we get our federal reimbursement back. It's extremely important that we're looking at that cap funding, and we're not going over that capped funding, because we do have cap funding, federal dollars, and we're able to have someone monitor it on the back end and ensure that we're switching that to a code that we are going to get the county the reimbursement, and it's not going towards county dollars. That is our goal here, is to make sure that we lessen the county dollar and we're maximizing those funds for you. One of those things is also, we were talking about overtime earlier. I think we are already looking at that, even though we really don't have the capacity. We're making sure that we're doing our due diligence and looking at overtime now for the county. And as Dr. Pugh mentioned, we have made some headways in looking at that, of coming down since I've been back. So I think that this would be a success for the department. It would pay for really itself, because it does get reimbursement, 50% reimbursement. But one of the key things I want to make sure that I let you know is that we can't afford to, we do get 50% reimbursement, but we can't afford not to have enough oversight in order to be getting 40% reimbursement for you, because obviously that's going to affect your revenues. And that's something that I don't want for you.
Thank you.
Thank you.
Thank you very much. I think that's all of them.
All right, going to the next to the last slide here, closing the gap. I mentioned the $5.8 million deficit. We've come up with some potential ideas to close the gap. First one is workers' comp deferral. So like we did last year with the insurance and bonds, the suggestion is that we defer our workers' comp, again, as a self-insured fund, and so we would defer payment from the general fund to the workers' comp fund for 1 year, and use that savings to close the gap, and that's about $2.4 million. The very last column there is basically taking our gap, and then as we put those items on there, it's decreasing the balance needed. The second idea is to use our salary lapse. We've had a substantial lapse every year, a significant amount of lapse every year in our salaries, and what we're suggesting is using some of that by basically budgeting a minus $1.2 million in the salary line, knowing that we're going to experience that lapse and we'll be fine. We won't be spending that money. The next item there is reduce the salary study funding. Currently in the budget, we have $1.2 million for an annual salary market study, and what we're suggesting is reducing that by $1 million, at least for this 1 year, and it could be extended further if need be. So that's another $1 million. Reduce the reserve we have for power and natural gas. Currently, we're budgeting about $518,000 as a reserve, just in case something happens with our power bills or natural gas prices go up. So we have that contingency built into our budget. We're suggesting reducing that by $250,000. That will still have a $268,000 reserve there. The other one underneath that is reduce the fuel reserve. Currently, we're budgeting $250,000. We're suggesting dropping that by $100,000, leaving just $150,000 in our fuel reserve. Contribution to EDC. There was some discussion in our prior meetings that you may want to kind of reduce our contribution to EDC or eliminate it. Our suggestion here is to reduce it by $250,000. We're currently budgeting $400,000 for the EDC. Reduce other adjustments. There's an adjustment line in our non-departmental budget that we had budgeted $255,000 in. We're suggesting we drop that by $152,000, to leave $100,000 in that line. And what that line was basically for in our salary adjustments account is if we missed a small budget item during our budget process, we would be able to use that money to make up for that item. It could be in salaries, it could be in some other line. We also typically use that item also to just balance the budget. When we're all said and done with all our revenues and expenses, if we have a little amount left, we'll just throw that into that line. That's why you see that odd number there. The last one there is defer hiring positions. And so we're suggesting deferring maybe 4 to 5 positions, where we would not hire them for a year. The vacant positions, we'll keep them vacant for a year, basically freezing that position, not hiring in for a year, open it up again the next year. Some of these are one-time, they're not recurring savings, like the workers' comp one, the defer hiring positions is one time, and possibly the salary study one may also not be something you want to continue on, because you want to make sure we're meeting market standards.
We have identified 4 positions already that will all but cover that gap on the 350. We did in the audit of all the positions discover some positions that at some point we think had been duplicated, so I took those off the table already. They're not even shown here, but that was another $430,000. So we just took it off because it wasn't supposed to be created in the first place. So this is the things that we came up with that we thought would be least painful, I guess, to get to cover the gap. That's assuming you leave the tax rate as it is. So beyond this, it does get more painful. But this is what we have come up with. You had requested for us to come up with some ideas, so these are the things that we are proposing.
Can you go back to what you had said? I want to just make sure I got clarification on that. The duplicate positions.
We discovered those. We audited all our positions, and we believe that there were some that were created by duplicate by accident at some point, and we took them off the table once we realized that they technically shouldn't have been there.
And that was
30,000. And obviously, none of them were filled. They were, we just audited everything.
But in the system, yeah.
They're gone. They're not in this. So this is an additional.
What departments was that? Do you recall?
There was a couple of parks, one IT. You remember who else? I don't remember.
Oh, I'd just be curious to know what.
Yeah, it was, like I said, it was, I think when they were in previous years when, I don't know, they somehow, it was, I think it was accidental because, like I said, they weren't overfilled or anything. So.
So next steps, we have our department budget conferences, which I mentioned to you earlier in my opening. That's happening in the month of March. And then we have a meeting with our educational partners in April 15th. So they'll come and present their budget needs to the Board of Commissioners. April 19th, the county manager will present the recommended budget. June 2nd, we'll have a budget public hearing. June 5th, we'll have another budget workshop or meeting if needed. And June 16th would be the budget adoption. A lot will also depend on what we get from our educational partners as far as what their needs are. Right now, like I said, we have 4.5% budgeted. If they come in with a lot higher and we want to fund that, then that would add to the deficit that we have. So we'll have to fill that gap even further. Any
Mr. Chairman,
questions?
Any questions?
Excuse me, I'm sorry, I thought you through. Go ahead.
No, go ahead.
I was just gonna point out, I was looking at this closing the gap thing, and if you cut $400,000 out by not funding the EDC at all, that you could do this $350,000 worth of filling in hiring positions that you need and have some left over.
Well, the proposal has cut it down to 250,000. I mean,
I'm
so
saying
she's.
cut it 400,000 out completely.
Right, okay,
And you can put it to better use.
okay.
I would not be in favor of totally defunding it, because they still do workforce development, they still do things with small businesses. I think, they're taking a massive hit anyway, but I wouldn't be in favor of totally defunding it.
Okay.
I mean, 250, that's reasonable, but they also do a lot of work with entrepreneurs and offering those services through Flywheel.
Okay.
Just my 2 cents.
All
Are
right.
they a government entity?
They're not a government entity.
Right, that's what I figured. They shouldn't get any taxpayer funding then.
Okay. All right. Any questions while we have Rush in front of us? She'll be here tomorrow, I assume.
Yes.
Any questions, comments?
I know there's
Yeah,
a lot
thank
of
you, yeah.
information. I'll be here tomorrow. There's this whole
Right.
session with us to discuss this further if you need be.
Okay.
Yeah, as we have a session set up just for you all to give feedback, ask questions. If you want to think about it overnight, this will give you a chance to come back with your thoughts tomorrow, and we'll take down whatever feedback you're giving us at that point to help us continue building the budget as we, get more information from our partners, more information from our growth and tax rates and our actual tax base. So that'll help us as we move forward. But from here, we'll need guidance from you on how you want to fill that gap. Are those the things you want, or are there other things? Or, if you want to fund positions, if we theoretically funded all of those positions and the reclasses, that's over $1 million. So that would, be another $1 million we'd have to find somewhere else.
Okay. Well, thank you, Kelly, for your hard work. And I know that a lot of this information was sent to us a week ago. And thank you for that, because in years past, we've walked into retreats with no information beforehand. And so it really helps to look over a lot of this before we get here, and we've had conversations, and that, it means a lot. So I want you to know that, and I want everybody in the room to hear it, that Kelly has been working extremely hard over the past few weeks. She has outdone herself. And she is a workhorse, and I'm sure most people know it, but I have seen it personally, firsthand. I've spent hours with you daily, and I want to thank you for your hard work.
Thank you.
You've been extremely responsive. if you don't know the answer, you surely find out within an hour, and it's greatly appreciated by, I don't want to speak for everyone, but I feel like I can. It's appreciated by every board member, and I want everybody to know it.
I appreciate that.
You've been phenomenal, so thank you. So, anybody else want to say anything? Everybody good? Okay.
Laura and I are having trouble with this button here.
You are
Yeah.
not alone. I've been having trouble all night.
I just want to echo that. I mean, I think Kelly's doing a great job, and like I told her the other day, she's very professional. She treats me so well, I can't tell if she likes me or not. I mean, that's the way it ought to be, you know? And she just does a good job.
She does.
So.
Agreed. And I'm not pushing this button anymore.
I know, my finger's tired.
All right. Well, we will recess until 8 a.m. tomorrow morning. There'll be a light breakfast served, so come hungry. All right. Thank you.